Hi everyone, my name's Haley, and this is my reflection on my professional identity as I finish up the RN-BSN program with Auburn University. When I first started nursing school, I thought it was going to be so easy, like this is a breeze, nurses, they're not that smart, I can easily do this. Boy, was I wrong. It's the hardest thing I've ever done, but it's also the most meaningful thing I've ever done, and I'm thankful for this calling that God gave me to be a nurse. It takes a lot of knowledge, it takes a lot of commitment, and as I went through the program, as I went through nursing school with Southern Union, and as I complete my RN-BSN program, I really understand how important and amazing nursing really is. Nurses are advocates, we're educators, we're critical thinkers, we're that source of comfort for patients and family members when they're going through some of the hardest times in their life. So now at the end of this program, I can really say that my identity as a nurse has grown a lot. I no longer see nursing as something that's so easy, it's just a little task to be done. I really see it as a profession that takes a lot of knowledge, it takes a lot of compassion and responsibility, and it takes that real commitment to serve others. So some values that are really important to me are compassion, integrity, empathy, accountability, and respect. I think these values fit closely with nursing because patients deserve patient-centered care. They deserve that self-care, that respect and kindness, because this is probably the scariest moment in their lives, like being in the hospital, being sick. They're very vulnerable, and I just want to be that kind of nurse that not only takes good care of the patients by giving them the medicines they need, but also makes them feel seen and heard and loved and cared for. I believe my faith has also shaped who I am as a nurse. Throughout nursing school, it's really reminded me like the importance of service, the importance of seeing the value of each person no matter where they came from, no matter what they do, no matter what they look like, and just treating them with the dignity and respect they deserve. Thinking of like professional standards and ethics, that's also helped shape my identity. When learning them in school, we learned about the ANA Code of Ethics. We've been learning about the Board of Nursing, and all those standards just remind me that nursing is not just about skills, it's just doing what's right. Because those Board of Ethics and Board of Nursing, they really help guide how we care for patients, how we make decisions as nurses. It reminds nurses to be honest, to be responsible, and to really put patient safety first. So as I was reflecting on the BSN outcomes, looking in our Canvas course, I can really see a lot of growth in myself with them. And the first one I want to talk about is the outcome 1. So it says, apply clinical judgment grounded in nursing science and knowledge from other disciplines to provide person-centered care and therapeutic communication for diverse individuals and families across the lifespan. So I've really grown in this area through both school and nursing experience, but what this really makes me think of is this semester, my IPE experience was my study abroad experience with Auburn. I was able to go with Auburn University School of Nursing. We went to Ecuador, and it was a faith-based program, and we did nursing care. We worked with doctors, nurse practitioners. We worked with child life specialists in Ecuador. We started a whole clinic there, and it was really eye-opening to me because all of these people in Ecuador were all living in poverty. They had limited resources, and it was just just eye-opening to see how much that affects their health and their day-to-day lives and how lucky we are here. And we use a lot of clinical judgment there because we would assess the patients and we would work with other disciplines to provide person-centered care. No matter, they're very diverse individuals, so no matter where they're from, what language they speak, and we worked with people from 90 years old all the way to a few months old. And so that was amazing to see and do. So the second outcome that I want to reflect on is outcome 2. It says advocate for health equity through policy, health promotion, care coordination, and disease prevention strategies. So that also kind of goes with my trip to Ecuador with Auburn University. We help prevent diseases by doing pap smears. So we helped with that, just giving like the supplies to healthcare providers and holding things for them. We also educated teens on STD prevention. We did a lot of discharge teaching on medications, and we did a lot of education on their diseases. So we were able to help the healthcare providers, and I gave like some information that I knew on that, so that was awesome. And also this semester I'm doing a project in my other class with Auburn. I'm doing disease prevention, so childhood obesity. So I went to a 3rd grade classroom and I talked to them about healthy eating, exercise, and the importance of that on your long-term health and your health now, and your focus, your mood, and everything. So that was also kind of had to do with outcome 2, like health promotion and education to care for the person as a whole and throughout their whole lives. So third outcome, outcome 3, employ scholarly and ethical approaches in the review, evaluation, and application of evidence to improve health and healthcare delivery. So this made me think of today was my project for this class, the Central Line Maintenance and Collapse Prevention Project. It really helped me understand evidence-based practice and research and how important it is for nurses to be that first line of patient safety outcomes, and how we can educate nurses for quality improvement, and how that really updates like current practice and evidence and really has an impact on patients' outcomes. The fourth outcome is establish professional identity guided by nursing knowledge, skills, attitudes, and values. That's outcome 7. And this outcome means the most to me because as I'm reflecting on my RN-BSN program throughout this video, I really feel more confident in who I am as a nurse, who I am as a person, and the kind of nurse I want to be. I've worked with a lot of different nurses throughout my time here, and it's really helped me see just the kind of nurse I want to be and the things I want to do. Like, I want to be very compassionate, I want to be a great leader, so all those things. So looking ahead, I want to grow into someone who's very knowledgeable, and I love learning about leadership. It's just not about your title. Like, if you're a supervisor, it's not just about that, but who you are as a person. And you can be a leader now. It doesn't matter what your title is. And some things that I'm interested in are med-surg, surgery of any kind. I love reconstructive surgery because I love art, and I feel like that's an art. I love orthopedics, labor and delivery, so I'm really excited to see where I'll end up, and I'm really thankful for this opportunity to go to Auburn, which was my dream, and get my bachelor's, and just learn about what it truly means to be a nurse. And thank you, Auburn. I'm excited for this lifelong learning and serving for these patients in my life. Thank you.